most sexually transmitted infections or STIs don't have any symptoms whatsoever. Some symptoms, if they are going to show symptoms, might not show up for a few days, some weeks or even months after sexual intercourse has taken place. So it's really important to make sure that you get an STI test regularly. We recommend about once a year. You might also sometimes mistake symptoms for something else, like a skin allergy or a skin condition. So that's why accessing sexual health services and getting tested for STIs is really important. The main thing to do if you think you might have an STI is to stay calm, because most STIs can be treated and go away with antibiotics. So it's not about worrying about it. If you do think you have an STI, it's really important to go and speak to a professional, either in a sexual health clinic or coming to us or another similar charity in Scotland. So STI testing takes place in many locations across Scotland. It's often provided by charities like ourselves and a few other charities that work across Scotland in sexual health. It could be in local youth centres, local community centres, or it could be at the sexual health clinics that NHS boards run across Scotland in local areas. It could also be at your local GP, and if you need to find out where to get a test, you can go on our website and use the service finder or call THT direct. So the simple answer is no, although it's a really good idea to tell them so that they can get tested as well in case they might have contracted it. In terms of the law, you don't have to tell them as long as you're taking precautions to look after their health. So if you have an STI, try and use condoms if you can. And as I said, it is a good idea to tell them. So it's really easy to prevent an STI. Just make sure that you use condoms and lube if you're having anal sex. Femidoms, dams are the other barrier methods of contraception. Remember that the pill and the coil and the implant and the patch doesn't prevent STIs. It's only barrier methods like condoms. So if you are on the pill or the patch or the injection or the implant or the other various methods of contraception, remember that unless you're using condoms as well, they don't prevent against STIs.